Hello, everyone. Welcome to the McMaster Health Forum here in Hamilton, Ontario at McMaster University. This is our latest Queen Elizabeth Scholars webinar. A quick agenda for what we're going to cover today. I will give you a quick summary of the McMaster Health Forum, a summary of the Queen Elizabeth Scholarship Program, and then I'll turn it over to our scholar presenter. The McMaster Health Forum acts as a leading hub for improving health outcomes through collective problem solving. We harness information, convene stakeholders, and prepare action-oriented leaders and act as an agent of change by empowering stakeholders. The Queen Elizabeth Scholarship Program, which is formerly called the Canadian Queen Elizabeth II Diamond Jubilee Scholarship, is managed through a unique partnership of Universities Canada, the Rita Hall Foundation, Community Foundations of Canada, and Canadian universities. This program is made possible with financial support from the Government of Canada, provincial governments, and the private sector. The purpose is to activate a dynamic community of young global leaders across the Commonwealth to create lasting impacts both at home and abroad through cross-cultural exchanges encompassing international education, discovery and inquiry, and professional experiences. The McMaster Health Forum is proud to be selected as one of 20 Canadian institutions to host this next round of scholars in the Queen Elizabeth Scholarship Program. This version of the program will run from 2018 to the end of 2021. The focus of this version of the QES program at the forum is called Strengthening Health and Social Systems. Our scholars will contribute to strengthening health and social systems and become part of our large and growing network of health and social systems leaders. Through our previous Queen Elizabeth Scholarship Program, we engaged 61 different students, 14 of whom, as you can see on the screen here, came to us from different Commonwealth countries from around the world. We also sent 3 Canadian scholars to work with partners around the world for scholarship purposes. And we also sent 44 students through internships to work with our scholars from around the world. Note that all of the placements and partners in the original QES program were Commonwealth countries. Our new program, which is who you'll be hearing from today, involves not just Commonwealth but also low and middle income countries. Our current Queen Elizabeth Scholarship Program has so far engaged 11 students. 4 of them are visiting us from different Commonwealth or low and middle income countries, and 7 have been sent abroad to work with our partners. So our webinar today actually has 2 presenters who traveled together to Trinidad and Tobago. Christie is one of those presenters. She, at the time of her internship, was an undergraduate student in the Bachelor of Health Sciences program at McMaster. She aspires to combine her experiences in clinical and biomedical settings to enhance her understanding of decision-making in healthcare. During her internship, her goal was to engage with different cultures, explore their ways of knowing, and understand regional healthcare challenges in the Caribbean. At the time of the recording of this webinar, she is an MD in the MD program at the University of Toronto. And our second presenter is Hannah. Hannah is an undergraduate student in the Bachelor of Health Sciences program at McMaster. She is interested in how the dynamic needs of a population can be met through health and social system changes supported by evidence-informed policymaking. During her internship, Hannah hoped to gain insight into how the mobilization of research evidence can be conducive to achieving more equitable health outcomes on a systems level. So, Hannah and Christie, I'm going to turn it over to you.
All right, thank you very much, James, for the warm introduction. And so Christy and I will just be presenting on our internship at the Caribbean Center for Health Systems Research and Development that we took part in just this past summer. And so we're just going to start off with some brief background. All right, so our journey began in Hamilton at the McMaster Health Forum, but we left the airport, Toronto Pearson International. The flight was it was less than 6 hours, and then we made it to Piarco International Airport in Trinidad and Tobago, and we made our way to St. Augustine. All right, so a bit about the host institution that fortunately welcomed us and allowed us to take part in this internship. So they are actually one of the newest partners of the McMaster Health Forum, and they were established just last year in April. And so some of their core functions include research, specifically HSPR, supporting knowledge translation activities. So they also provide services like the Rapid Response Program, which we will be talking about in a bit, community engagement, as well as training. During our time there, we were fortunate enough to witness some of the workshops being held, specifically some statistic ones, in order to enhance and equip researchers to tackle health and social system challenges.
So before we talk a little bit about the projects that we worked on, we just wanted to go over some of our personal objectives before entering our internship. So both Hannah and I actually were able to take a health policy course before leaving for Trinidad. And we were able to gain a lot of hands-on or theoretical experience through these classes. But one thing that we really wanted to have was more of that hands-on experience and be able to apply the things that we learned in class to a real-world challenge and setting. Our second goal was to learn how to get more involved in policymaking processes as a student, since sometimes this is a process that can be quite difficult, as there tends to be a bit of a gap between students and what they learn and policymakers and what they do. And the last objective that I will talk about will be our desire to enhance research skills, problem solving and analysis skills in health systems research and social systems research.
Another objective that we had was to learn more about ways in which we could achieve greater health equity on a systems level. And so that means like acknowledging a lot of the social circumstances that come into play when it comes to determining an individual's health. And lastly, we had the objective of furthering our understanding on the role of context when it comes to supporting measures regarding evidence-informed policymaking, so the role of institutions, the role of culture, historical legacies, and infrastructure.
So now we're going to talk a little bit about some of the projects that we completed while we were at the CCHSRD.
All right, so the first major project that we were fortunate enough to work on was the Rapid Response Service, and initially we were tasked with implementing and piloting the service. However, objectives did change as our internship progressed. So initially, what we were responsible for was conducting this review on the available literature and taking a look at programs currently in place that offer such a service. And for those of you without background on this topic, Rapid Response Service is essentially one that seeks to bridge the gap between researchers, policymakers, and other stakeholders by providing the best available research evidence in a way that is accessible, highly digestible in a short turnaround time. And so the scope of this service includes, like specifically for the CCHSRD, specifically includes health system challenges, but also social system challenges, and acting as a proponent for the UN Sustainable Development Goals, similar to what we have here at the McMaster Health Forum. All right, so a lot of our responsibilities with this project specifically was to define the service that was to be offered by the CCHSRD. And so in doing so, we had to keep in mind the values and the vision of the organization while we consulted the literature and we took a look at current programs. And so the product being produced by the service in particular is the Rapid Response Brief. And this centers on a research question which could involve, clarifying the causes of a problem, identifying solutions specifically to address a health system issue, looking into the implementation considerations and the barriers that could be associated with implementing a certain option. And so this service in particular with the center is meant to be in partnership with the Ministry of Health of Trinidad and Tobago, and the paper that we wrote in regards to this program was actually presented to them. And so in addition, when defining the program and developing the guidelines, we looked at the delivery time as well, looking at similar programs of different organizations, and they also intend to follow a similar time frames, like the McMaster Health Forum of 30, 60 to 90 days, according to the needs of the requester as well as available resources. All right, so in terms of the need for the service, why exactly this service is valuable in the first place, Christie and I took a look at studies that investigated some of the benefits and looked at some evaluative studies. And so the reason why this service is so valuable is because it addresses a major barrier to the use of research and policymaking, which is that there's a lack of timely access to research that is relevant. And so this The service acts to close that no-do gap, and based on some of the studies that we had a chance to look at, it was found that participants who used the service had greater confidence in decision-making, and overall programs like these contribute to fostering a greater culture of evidence-informed policymaking. So while we were looking at the literature and trying to come up with the paper regarding the service that the CCHSRD would provide, it was important for us to define specifically the product that would be offered. The rapid review, that term is used often interchangeably with rapid response brief in the literature, even though they do differ quite a bit. So a rapid review is different from a rapid response brief in that it's more of a condensed systematic review, whereas a rapid response brief seeks to present like formalized new conclusions, and as such, the rapid response brief does not seek to present new findings, and as such just presents the available evidence and lets the policymaker or the decision maker act upon it. The next important consideration was that during the internship, our objectives did change, and while we were initially meant to pilot the service, it became clear that it was necessary to first advocate for the need for the service in the first place, to explain why it is that such a service would be valuable to potential requesters, specifically the Ministry of Health of Trinidad and Tobago. And finally, an important consideration was that specifically for the rapid response briefs, they wouldn't include recommendations, and that's because we wouldn't want authors to weigh in on their own personal values and opinions when writing up the evidence briefs and other rapid products. And so in looking at our key insights overall from this project, we found that there is a great need for evaluation and monitoring systems. And so there are a lot of similar programs offered by different organizations, including the Master Health Forum, but it's clear that there needs to be more research in regards to the effect specifically these programs have had on policymaking. And to continue, another insight that we had was that success is really dependent on network and the collaboration. And so establishing the network of potential requesters and really advocating for the service is necessary. And finally, specifically for services like these, it's essential to tailor findings to the local context.
So I will talk a little bit about the second project that we had a chance to work on, which was a proposal to advocate for having more citizen voices within policymaking processes. So the funding proposal that we were writing up was actually for a larger project at the CCHSRD, which is known as Ready for Universal Health Coverage. So essentially the Ready project is an acronym that stands for the use of research, evidence, and dialogue to shape policy. This is an innovation that was piloted at the CCHSRD and is essentially a proof of concept of whether or not they can take policy changes and issues that are current in the Caribbean setting, to conduct research on these issues, and then promote dialogue series with citizens and stakeholders to advocate for certain policy issues that might arise.